Happy day to our viewers in Guam and the Northern Mariana Islands. Happy Friday. We're grateful today to be joined by the Laboratory Director at the Commonwealth Healthcare Corporation here on Saipan, a pathology and laboratory medicine specialist, Dr. Phillip Dauterman. Doctor, thank you for joining us. How are you doing?
Doing very well. Thank you very much.
Thank you. We know it's a busy time, so we want to go ahead and jump right in. How has community testing process gone so far on Saipan, and how many tests are we running a day? We know that there was just the temporary suspension of the community testing program for the weekend.
So far it's going very well. We've been averaging about 100 tests per day, and the testing has been well received in the community. And this has been a big milestone for the CNMI because it's the first time that we're able to go out into the community and do community-based testing, such as the drive-through testing that we're having at the airport right now. And it's instrumental for surveillance for COVID-19 in the CNMI.
And so how many tests are we, I know you said we're running 100 a day. If we wanted to test more, how many are we able to run, and how many people are working in the lab at CHC to monitor the results for you?
If we were to run the testing 24 hours a day, we could probably do about 250 in one day, but that would require the staffing. Right now, we have 4 of our own lab staff that are working on the testing, and we just received yesterday an additional 4 that came from the military. They were sent by FEMA and DOD, and they're military lab techs that will be here temporarily for maybe 1 or 2 months. And they will help with the testing. So that will actually allow us to expand and increase the testing, because we can now run, instead of 1 shift a day, we can run 2 or 3 shifts a day with the added personnel.
And so I know with the most recent case, some viewers were asking, how can a confirmed case be non-infectious? Of course, we spoke with CEO Esther Muña, who explained it to us, and we reported that. But for those who are just tuning in, what does a confirmed positive non-infectious case mean?
What happened in a recent case is that one of the surveillance testing cases fell out as positive on the Solgent, and we decided that we would repeat the testing on a on a Gene Expert and an Abbott. The test came out positive on the Abbott and negative on the Gene Expert. So it's not really a confirmed case. It's kind of more like a split decision on the testing. 2 of the tests are positive and 1 test is negative. So we're really not sure what's going on in that particular case. But I think they decided to be on the safe side and quarantine the person and do the contact tracing. But I don't think you can call it a confirmed case, because not all the testing was positive.
And I wanted to follow up asking some questions that viewers are submitting about, are the plans for testing right now just through the drive-through, or are there also conversations about doing testings in villages or at homes for residents?
I just handled the testing aspect, and as to the actual going out into the community, that would be AOC or, in other words, the Agency Operations Center, or else the CEO, Esther Muña. You could ask them where they're going to go next. I honestly don't know where the drive-through testing will go next, but I have heard that there's plans to expand it and move it to other locations.
All right, and speaking about the testing process that you handle, can you walk us through the testing process? What happens once someone is registered, goes to the airport, and their specimen is collected? Where does it go from there?
From the airport, the specimen will go into CHC laboratory, into a freezer, and we will collect up specimens until there's enough to run 1 batch. And a batch is approximately 94. So we save it up until there's 94 in the freezer. And then we take it out from the freezer and we bring it to the testing room and we let it thaw out. While it's thawing out, we're preparing the reagents to do the testing. So they're mixing up a series of reagents into what's called a master mix. And then the specimens are 1 by 1 put into little test tubes and put into a plate. And then the aliquots, that is little droplets of the master mix, are added to each well. That is, each tube has a little droplet added. Then from there, it goes into a testing analyzer. The testing analyzer will make a graph showing whether there is or is not amplification. Then from there, it requires 2 people to read the graph, 1 lab tech and myself as the lab director. So we will both look at the graph. we will determine a positive or negative. If there's no amplification, it's negative. You don't have coronavirus. If there is amplification, that's a positive. And so that means you have coronavirus, or at least you're suspect for coronavirus at that point. So then we turn out the results. The negative, we log into a spreadsheet. The positive, in addition to log in the spreadsheet, if there's positive, I immediately call the AOC, which is the Agency Operations Center, and inform them that there was a positive. They will then call that person for more testing. So anybody that's positive, they will get a phone call to come in for more testing. And a second specimen will be drawn, which will be tested on the Abbott. So if the first test is positive and the second test is negative, we still think that they are negative. We would call that false positive on the Diaplex. And if they're positive on both, then we think that they really do have coronavirus. So that's our testing pathway right now for the community-based Solgent Diaplex testing.
Thank you for drawing that out for us. I want to ask, so it's just you and that lab tech. How many hours are you working a day, and what does that work on?
Right now, it's like about a 7 a.m. to maybe 6 p.m. So with 1 hour off for lunch, so maybe 10-hour a day during the weekdays. I have to come in on the weekends because they're running the test on the weekend as well. So I'm putting in maybe 4 to 8 hours Saturdays and Sundays.
All right. I wanted to bring up an old subject. I know it's been discussed in length with the CEO as well, but for the viewers just tuning in, we know that on Guam, the South Korea test kits, the Solgent ones, drew some controversy with the governor there, saying that they don't have the emergency authorization use and they're not US FDA approved. We've talked about this and reported on it. Can you, though, explain the efficacy rate of the drive-through testing and why they're reliable for surveillance? And here on Saipan.
Under the CLIA laws, surveillance is different from patient testing. So America's laws governing clinical laboratory testing will say that you have to validate or verify a test before you can use it for patient testing. So that kind of testing is like when somebody comes to the emergency room with a cough and a fever and short of breath, and you want to do coronavirus testing. That test has to be validated. But for like an epidemiology or screening test, the CLIA laws do not cover epidemiology, screening, and surveillance testing. So the law really doesn't apply to the Solgent Diaplex testing that we're doing. So the difference is where we're not actually testing patients with the Solgent Diaplex. If somebody comes in sick to CHC, they'll get tested on the GeneXpert or the Abbott ID Now, and both of those are approved by FDA for use in the U.S. for patient testing. And the test that's not FDA approved, we're only using for like the drive-through screening, which is basically people come in who are curious and they want to know if they have coronavirus. They will come in and get the test, and these people will not be symptomatic. That is, they don't have cough, they don't have fever, they're not short of breath. They're just normal people walking down the street and curious if they have the coronavirus. So there's really two different types of testing, and it's kind of like comparing apples and oranges. The rules are different for the testing, and so you can't apply the rules for one kind of testing to the other kind of testing. And so the primary purpose of the community testing is to determine the prevalence of COVID-19 in the population. That is, how many people or what percent of the people on Saipan have COVID-19. And so this is not being used for the final diagnosis. This is just being used like a screening tool. And we only use the FDA-approved tests for the patient diagnosis. And so I just kind of needed to explain that difference.
Right. Thank you for explaining that. I know you've reported on that previously. I wanted to shift our focus now to antibody testing. We know that across the nation, this is something that's becoming more of a conversation. To shift to that, is that a possibility at all for the Northern Mariana Islands?
At this phase of the pandemic, we're more concerned about diagnosing active cases. So we're at this point only deploying the nucleic acid testing, that is Solgent Diaplex, GeneXpert, and Abbott ID Now. They're all the PCR, that is the DNA nucleic acid testing. We are planning to do the antibody screening, but that would be later on in the pandemic after there's been a significant transmission of the coronavirus through the community. At this point, we think there hasn't been. It's too early in the pandemic, so we haven't started at this point with the serology screening.
All right, I wanted to wrap up our conversation today with your view as a flight to start, and some businesses are proposing plans to gradually reopen. as a doctor, as a pathology specialist, what's your message to the community as maybe we're coming out more and being out and about, interacting in public?
The instructions can be found on the CHC website, and that will list all of the public health recommendations for staying safe during the coronavirus pandemic. It mainly relates to good hand hygiene, such as washing your hands frequently, cover your coughs and sneezes, use alcohol-based hand sanitizer if you don't have access to soap and water for hand washing, and to stay home as much as possible. Don't go out from your home unless you really need to, and if you're doing essential work like shopping, make sure only one person goes out from the house to do the shopping, and don't allow the vulnerable people to go shopping, such as the elderly and the small children. Leave the small children at home when you're going shopping. And that older adults and people with medical conditions should probably stay home and not go out from the house.
All right, we want to thank you so much for your insight and expertise. Thank you to our viewers on Guam and the Northern Marianas for joining us. Again, that's Dr. Phillip Dauterman, Laboratory Director at CHCC on Saipan. My name is Tomas Mangloña. Thank you for joining us.